Hi guys, it's me again. This is lockdown Tuesday in the Northern Beaches. A fairly wet and miserable day. Perfect weather for the hump day in this 3-day lockdown. If it is indeed a 3-day lockdown, time will tell. It depends if the Emperor decides that we can actually live normally again as of 4 o'clock tomorrow, or it's just going to drag on. As I say, well, I'm just a minion. I have no power. It's basically up to the people in control. And that does concern me because I'm a libertarian and I'd like to see less government control, but dream on. Anyway, the reason I'm making this particular video today is in response to a posting that one of my subscribers, who I've met a few times, and he's a good guy, but he came to the conclusion that the government must be on the right track because Australia has such a low COVID death rate. And that is actually true. I did check out the stats. Certainly on the overall world scale, the per capita death rate in Australia is lower. However, I don't know whether I'd come to the conclusion, because of all these draconian lockdowns has actually been the main reason why this has occurred. There are a number of factors there. So I decided to do a bit of research and looked in online for an article that would go into a bit of depth regarding this issue, because one thing you won't get from the mainstream media is an incisive, in-depth article. It's very, very rare. And if you really want to look at the causes behind an issue like this, which is a complicated issue, I think you then need to look at a specialist publication. And I found one called Healthline, an American publication, which gives a few insights into the situation with COVID. And I was going to use the argument saying that in certain states like Florida and Texas in America were doing better than other states such as California and New York, who actually had draconian lockdowns, whereas the likes of Florida were fairly free states. But again, if you look at the nitty-gritty, it's much more complicated than that. And I'll give you an overview of this from this particular article, which I would recommend. I think it's very well written, and it appears to be one of those rare occasions where it's not full of absolute bias, and it's actually trying to look at this situation in a rational way. And I think that's something we do need to look at more closely, because I'm not overly impressed with the way the masks are being used as a cure-all, which has been found to be not the case. And you have people like Dr. Fauci in the US, who's changed his position on this many times, which does undermine public confidence. Anyway, I'll just get this article that I've got on my pad and put on my specs, and we'll go through it, and I think you'll find it's quite illuminating. And it's asking the same question that I would have posed to Sid, who actually who posted that particular comment. Why do California and Florida have similar COVID-19 case rates? The answer is complicated. Now, despite different restrictions during the pandemic, California and Florida have had similar per capita rates of COVID-19 cases. Experts say safety rules are only part of the equation when it comes to COVID-19 case spread. There's also housing density, income levels, and health systems. Experts note that North Dakota and South Dakota are amongst the least restrictive states, but amongst the highest in per capita cases. All data and statistics are based on public available data at the time of publication. I think it was around February this year, so just bear with me on that one. It's not right up to date, but I think we can still learn a fair bit from this article. California and Florida have taken different approaches to managing the COVID-19 pandemic. Both states initiated lockdowns early in the pandemic, but since then Florida has eschewed mask mandates, lockdowns and other public health guidelines to mitigate deaths and hospitalisations from COVID-19. California, on the other hand, has had multiple lockdowns and a mask mandate in place since June 18, 2020. Despite this, per capita cases, hospitalisation and deaths from COVID-19 in these states are similar. California has had about 8,900 cases per 100,000 people, while Florida has had about 8,700 per 100,000. That has been seized upon by some as evidence that mask wearing, physical distancing and other mitigation efforts are not effective at preventing the spread of the virus. However, experts say the real reason for this dynamic is much more complicated. Confounders abound. First, I kind of reject the premise of the California versus Florida comparison. An associate professor of epidemiology at the LNC Gilling School of Global Public Health told Healthline, COVID deniers are cherry-picking a restrictive state that's done worse than other restrictive states and chosen a permissive state that has fared better than other permissive states. The comparison isn't an accident. They are stacking the deck by choosing outliers that favour their arguments, she said. The data bears this out. North Dakota and South Dakota are among the least restrictive states in the country with the higher per capita cases rates of COVID-19 in the country. North Dakota has had 13,036 cases per 100,000 residents, while South Dakota has had 12,585 per 100,000, according to data tracking from New York Times. Not that the New York Times is a particularly reliable source, I might add. But anyway, Vermont and Hawaii, on the other hand, have had some of the lowest per capita rates in the country, 2,341 and 1,912 per 100,000 respectively, and amongst the most restrictive policies according to data analysis from Wally Hub. This doesn't necessarily prove that more restrictions are better than fewer either, and that's just the point. And that's what I like about this argument, this article. There are so many measured and unmeasured variables that are different between those states. All of those are at play right now. You're asking us to have a deep understanding of a virus that's only been around for 12 to 14 months, said Brian C. Casarusi, PhD President and Chief Executive Officer of the Beaumont Foundation and a former Director of State Health Departments in Georgia and Texas. Some of these variables that change state by state include differences in housing density, including how many families live together in a single apartment or apartment complex, and the number of densely populated cities where super spreader events can quickly lead to large spike in cases, as well as income level, age and race. But separating out and controlling for these variables is difficult at this stage. I can't explain why Florida is not worse off than it is. I don't know why, Castrucci told Healthline. And I really appreciate that they're prepared to admit that they don't have all the clues. It's a rare thing to see if someone in public actually have the guts to admit that. So I'm very, very impressed. We're still learning a lot about this virus. So that's good to hear. That's a rational approach, looking abroad for answers. But containing COVID-19 is far from an unsolvable dilemma. Countries such as New Zealand, Vietnam, and even China have had success containing the virus. The measures these countries have used include robust contact tracing, strict quarantines, and social supports such as delivering regular meals to people in quarantine and paying them to stay home. In other words, mitigation isn't a mystery. The United States response has simply fallen short. Even very restrictive states weren't all that restrictive when they compare to places like Spain, Italy, Australia, New Zealand, Robinson said. Without good quarantines, income supports, worker rights, a lot of what has done in states like California was nibbling around the edges. Closed schools and churches, but open restaurants and bars. These sorts of intermittent and at times contradictory containment measures might simply be insufficient to significantly curtail the damage that COVID-19 causes. Some measures are more pandemic theatre than best prevention, Robinson said. Places like Japan have taken smarter, more targeted approaches, really clamping down on super spreader situations, but being more permissive about low-risk activities. The alternative, treating activities that vary greatly in riskiness as equally risky, leads to really bad decision-making. At the individual level, people are generally confused and also lets governments off the hook for bad public policy at some points, open indoor dining but closed parks, she added. Yeah, and I totally agree with that one. That makes some very good points, because there's been so much hypocrisy and inconsistencies in a lot of these policies. Now we're talking about America's impossible problem. The bigger problem might lie with some uniquely American structural and cultural barriers, along with a lack of public health investment. The first is federalism. Interesting, federalism. I think we've heard of another country that may have federalism. Could that possibly be Australia? Yes. Well, the first is federalism, which is the autonomy each state has, and why the federal government let COVID-19 response up to each individual state at the beginning of the pandemic. I've been in states where I've been working in the health department, and there's been an outbreak in our state. We can handle that. It's within the boundaries of our state, Castrucci said. If that outbreak then went to the state next to me and the state next to them, we do need federal support, because we need someone coordinating this while we're still debating. But that didn't happen during COVID-19, despite it being an interstate phenomenon early. Federalism has never been applied in the way that Trump administration applied it, Castrucci said. They said, hey, it's the state's problem, and then we had a provision, and now we're all trying to compare which of those dishes on the buffet are better. Pandemic response should not be choose your own adventure book. I'm not overly impressed with Scott Morrison's response with this ridiculous national cabinet notion. I think it's been a total failure personally. It's been a total lack of leadership at the federal level, which has led to all these lockdowns and has caused immeasurable economic damage to this country and mental health crisis. So it's been a major problem. And isn't it interesting that latest opinion polls are showing that Scott Morrison's approval is in the toilet? Big surprise. The fact that we have allowed our public health system to erode over the past several decades, so we were wholly unprepared for this, Castrucci said. We spend $700 billion a year on defence, and we've been preparing for the wrong war. This was not an if, this was a when, he said, and we didn't invest in our labs and public health system, and now we have we've been taught an extraordinarily hard lesson by COVID-19. The safety, security and economic prosperity of the country going forward is predicated on a robust public health system that I don't think we have the political will to invent. I think it's a great risk that the vulnerability will persist following COVID-19, he added. Robinson agreed, noting that growing anti-science sentiment among the American public has also been an issue, a problem that can only be solved through strong leadership and education. Our society is attraction to absolutes, miracle cures and black and white answers has made the COVID-19 response harder and less sustainable, she said. And boy, that pretty well sums up the attitude of the media, in my opinion, have been less than responsible. And looking at why, say, Australia and the likes of New Zealand have done particularly well with the actual COVID fatality rate, I would actually say that it's got something to do with the fact that we're both islands. That helps us out immeasurably as well. In the States, of course, you can have people travelling from state to state much easier. And it's a big country, there's 300 million people, so that the possibilities of infections are greater, especially when you have a country that has an immigration policy that basically allows illegal migrants to go into the country, actually pays to have them distributed right throughout the country, and those particular migrants aren't checked for COVID. I mean, it's just a bizarre setup. I mean, is it any wonder that the States is not faring as well as Australia? So look, that makes perfect sense to me. It is a complex problem. There are a lot of issues involved. I wouldn't be patting the state governments on the back so quickly. They've made some terrible errors. We've had quarantine stuff-ups. We've had the tourist ship stuff-up in New South Wales. They're not exactly clean skins when it comes to culpability in the COVID situation, but we are lucky that we have had we've had a low rate, well, I'm not saying we've done everything wrong, obviously not, and but I think we've had a heavy hand of lockdowns, which has caused a lot of strife. That we could have received the same outcome with a much lighter touch. That's my contention. But look, it's up for debate. But I just wanted to put forward that particular article. I think it's quite balanced and does provide both sides of the story and gives a bit of another perspective on the situation. The other thing we've got to think about too is that being a virus doesn't give us stuff about what we're planning. If we're, by cutting back on the number of people who have actually contracted COVID-19 in Australia, might come back to bite us, because another variant of the disease might affect a population that hasn't got herd immunity much greater than one that has. So, we might feel a little cocky at the moment, but there's nothing guaranteed long term. And, it's a tough battle. I'm just hoping that we can get positive results without such a heavy hand to our civil liberties, and a bit more rationality when it comes to the mask side of things too, because I just don't think that these cloth masks are having that much effect, and we should fess up to that. Anyway, that's basically my overview of it. I hope that's cleared a few things up and enlightened you a bit. As usual, would you please give me thumbs up, thumbs down and comment, and I would appreciate any more subscribers. That would be lovely. Thank you very much. Have a great day, and fingers crossed tomorrow is our last day of lockdown.